pandemics arise out of outbreaks. It's an outbreak that starts somewhere, then becomes an epidemic, then becomes a pandemic which goes to other countries. There's nothing that is called a pandemic from ground zero. So there are several layers then to think about. If you're going to be pandemic prepared, you must be outbreak prepared. So the first thing about pandemic preparedness is ensuring that everyone everywhere has access to the needed health services that are optimal to identify their needs and to prevent diseases, to identify them early and to control them.
When it comes to the health system strengthening, what that means is that we cannot leave any of the pillars behind. So if it comes to investment, we have to ensure that all the pillars are well resourced. When it comes to operations, we have to ensure that all the pillars are working together. The coordination of the health system is very important to ensure that, we move together at the same level, at the same speed, whether public or private, or whether you're playing in any of the subsectors of health, so that we strengthen everyone. And only when everyone is strengthened, only when all the pillars are strengthened and are moving together in one direction, can we actually achieve a very well functioning health ecosystem. And very important that this is what feeds into the universal healthcare.
Primary healthcare has it's like a three-legged stool. One is community awareness and empowerment. That's primary healthcare. When you talk about community awareness and empowerment, you're talking about not the nurse in the clinic, not the clinic. You're talking about the mother in the household who knows how to respond to fire, but also knows that if their child is coughing, this is what they should do. That is one wing of primary healthcare. The second one is primary care. Primary care means that if all those preventions and everything fails, and you have a cough, you go somewhere and the cough is identified and you're treated. That's primary care. Testing at home, referring to the health facility, and the health facility you're referring to must have a health worker, most likely a nurse, if you're lucky a medical officer, but must also have the system to identify, and the nurses should be so aware of pandemic preparedness that if the disease is strange, they should take a sample, and there should be a referral system of that sample to the nearest level 3 or level 4 hospital for it to be tested. And the final leg of primary healthcare is multi-stakeholder engagement, making sure that health is too important to be left to the health sector alone, that the veterinary doctor in the community is aware that there are cows dying and therefore communicates to the local nurse and says, this week we lost very many cows, check whether there is anyone with a strange symptom, because then they coordinate. It's about private sector playing a role. It's about the people in water and sanitation being part of primary healthcare. So if we make this work at a local level, then we are pandemic prepared.